Well, I might get us started then. Hi, everyone. My name's Ben Corio. I'm one of the team members here at CERSH, which is the Centre for Excellence in Rural Sexual Health. I work from Wangaratta in Northeast Victoria and live in Deakin. It's my pleasure to welcome you to CERSH's Sexual Wellness Professional Development webinar for May 2023. We hold these most months of the year, so we'd really encourage you to subscribe to our newsletter and keep your eyes peeled for webinars. We cover a variety of topics. Before we go any further, I'd like to offer an acknowledgement of country. On behalf of CERSH, I'd like to acknowledge the Yamatang people, who are the traditional custodians of the land that I'm speaking to you from. I also acknowledge the traditional custodians of the lands on which each of you are living and working today. We extend our respect to elders past and present, and to all Aboriginal and Torres Strait Islander colleagues joining us today. We'd love it if you could introduce yourself and acknowledge the country that you're calling in from in the chat. So it's my pleasure to introduce Debbie Ollis. Debbie is an associate professor in education at Deakin University, where she teaches and researches in the fields of gender, respectful relationships, and sexuality education. Debbie has worked in the health and sexuality education field for over 30 years as a secondary school teacher, policy officer, curriculum consultant, curriculum writer, teacher educator, and researcher. She's also co-authored 2 national frameworks in the area and written curriculum resources for state and federal governments. Most recently, she has written a respectful relationships curriculum for Victorian secondary schools and co-authored a sexuality education monograph for universities. Her research is focused on capacity building in health and sexuality education, teacher education, gender and violence education, and young people's experiences of school-based sexuality education. Debbie is currently involved in a number of projects in these areas, including an ARC linkage project researching young people's experience and voice in sexuality education. So we're obviously thrilled to have Debbie here with us. Just a little bit of housekeeping before I hand over to Debbie. We'll have plenty of time, hopefully, for questions at the end of the presentation. If you could use the Q&A or the chat function to ask your questions as they occur to you throughout the presentation. I'll do my best to consolidate those, so if there's any doubles, we'll sort of combine them, and then I'll pose them to Debbie after the presentation. You can also drop them in the chat when we get to the Q&A section, if that's when they occur to you. We are recording this session, so if you'd like for your questions to be anonymous, please just note that, and I'll just say anonymous asks rather than naming you. So without any further ado, thank you so much, Debbie. Over to you.
Thank you, Ben. It's probably time I updated that bio, but before I start, look, I would like to also acknowledge the country that I'm on and the traditional land of the Wurundjeri, Worong and Barrernong people of the Kulin Nation, and to acknowledge all the lands on which we're meeting today virtually, and pay my respects to elders past, present and emerging of all the lands that we work on, and their ancestral spirits with gratitude and respect. As I said, it's about time I updated that bio. I actually was supposed to retire last year in August, but very hard to after the number of projects I've been working on, but I'll talk a bit more about that later. So look, thank you very much for coming along today. I know as a teacher, it's not an easy thing to do at 4 o'clock after a full day at school. So I hope that there'll be something useful in this presentation. So I'm just going to share my screen. Just hope that everybody can see that. Is that clear? Ben, is that clear? Great. So look, what I'm hoping to do today is, I guess, provide a context for what I refer to as sexuality education, which could be sexuality and relationships education, relationships and sexuality education, respectful relationships education, but in the context of 2013 and in the context very much of Victoria, which is where a lot of my work is currently. So I'm basically going to look at the nature and continuing extent of gender-based violence as one of those contexts. The calls by young people to bring about change in this area and in the education we provide for them. The impact of the Australian curriculum changes and legal changes, particularly in Victoria and New South Wales. I guess some of the important research that has emerged, particularly in the last 12 months, and I guess what's happening in Victoria to contextualise the updating of all Victorian resources. So, and I noticed I saw somebody from Darwin was here. And look, I apologise, I focused this very much on the work that's going on in Victoria, because currently we are in the process of updating all our respectful relationships curriculum and all our sexuality education curriculum. So that's the context for the webinar today. So look, I just want to start with, the nature and continuing extent of gender-based violence. Now, what I did on Monday was just did a quick search of headlines around violence against women and gender-based violence, and I could not fit them onto a PowerPoint slide. So it's just, this is 2023. This is the last couple of weeks. The extent, the number of women and partners who are being murdered, the extent of violence against gender and sexually diverse young people. It's just continues. And I began work in this space back in 1991, and very little has changed in the nature and extent of gender-based violence, except for that sort of online space, and we'll be talking about that today. So it is an endemic problem. In addition, it's our schools. So it's also about what's happening both in our schools and in relation to our schools. So again, a couple of headlines this week, Andrew Tate's sexist propaganda, which Australian classrooms are having to deal with. Tip of the iceberg around issues around sexual assault, historical sexual assaults and what's emerging for young people in schools. And also, I guess the point I also want to make, it is happening in our schools and it is impacting on our students and on our school environments. And so there are two illustrations I'd just like to provide, which are, one is Australian, one's Victorian. And in 2016, more than 70 Australian schools were targeted by a pornography ring, where young men were swapping explicit sexual images of female students that they had gained without consent. So this is going on across the country. And these are the sorts of comments that were being that were found on the site. Does anybody have any St. Clair Year 12 wins? And by a win, that's being able to get a non-consensual photograph of a nude of a young woman that they're trying to trade with. I've got heaps of Miami High School girls. Kick me if you want to trade. Who has nudes of this bitch? I hear she throws it around. I'll upload the nudes I have if people start looking for Hunter Valley, Newcastle, Port Macquarie girls, any hot sluts. And I won't go through the rest. You can read it yourself. But it was abhorrent and it was happening across the country. The other one I would like to share with you is that the chant that occurred at St. Kevin's, just to remind us of what we're dealing with. And Ben, would you like to... So if I stop sharing, this is so that I don't mess up the...
I think it's going to work best
with me?
if you share that one. Yeah, only because my...
That's right, I forgot. Yeah, I'll go back to... Yep.
Thanks, Debbie.
Yep. I'll just go back to sharing again, sorry. Okay. This is the dread that you do when you all right, so yeah. Can everybody see that?
So we can see your PowerPoint, not the
Okay,
video.
great. I just wanted to make sure that I have to just go through it again. There we are. So I'm going to have to open that. Stop sharing. That work?
It's working.
Okay. So I just to give you a sense of how endemic the issues that schools are facing around issues to do with gender-based violence and sexuality-related issues. The other context is around gender and sexual diversity. So what we know for these young people is that, you know, close to 60% report that they've been verbally assaulted, 15% reported physical assault, 29% reported sexual abuse. And I think that what is most concerning about that is that 28% of that was happening in educational institutions like schools. In addition, when it's broken down by gender, that the highest levels of harassment are for trans women, trans men, and non-binary young people. So the second context is calls by young people for change around consent. And hopefully you have all are aware of Chanel Contos' amazing influence in bringing about the mandatory teaching of consent in Australian schools. Now, that's why I need to update my bio. It's 40 years, close to 45 years, that I've actually been trying to do what Chanel Contos has managed to do in a couple of years. So I just would like to share one of these.
Well, a major win for a
Sharing and
Debbie, if you reshare that, we actually heard and saw that pretty clearly, if that's easier.
Oh, that's great. Yep. Maybe I managed to actually embed that one properly.
former Sydney school student today in her campaign to teach consent, 1 year after Chanel Contos triggered a reckoning with a petition demanding earlier and better education. Ministers around Australia have unanimously agreed to mandate holistic and age-appropriate consent lessons from prep through to year 10. And Chanel Contos joins us now. Chanel, what a brilliant outcome. How did you feel when you got the news?
I was a bit of shock when I got the news, but the first time I ever saw the curriculum and what was being proposed to be taught, I cried while I was on the phone with the people who work at the Australian Curriculum Authority.
Now, tell us, what does this mean for our kids? What will they be learning that they didn't learn before?
Well, for some students around Australia, they've never had any consent education at any age. So, I mean, yeah, they'll be learning consent and empathy and respectful relationships. But this is quite game-changing. And in terms of curriculum that I've looked at in lots of different countries, it's definitely one of the best I've kind of ever seen in the world in terms of the fact that it builds on concepts of power and gender and age and coercion from a young age in an age-appropriate way. So as young as 5 years old, when students are in kindergarten, they'll be learning about simple things like asking for permission and denying permission and help-seeking strategies. And then as they grow older, these concepts get more complex, so that by the time they reach high school and we start talking about consent in an explicitly sexual way, these concepts make a lot of sense.
I guess the thing that's interesting about this is it really places a lot of faith in education being the solution to this problem. Why do you have so much faith in education as the key here?
I just believe education can be the most transformative way to change a culture. And that's really what we're dealing with here. We're changing a culture. A lot of the testimonies on my website, I read thousands of them. And sometimes the acts described were explicit acts of violence that were malicious and intentional, but in almost all cases, these acts were perpetrated unconsciously and unknowingly by the perpetrator and often the victim. And I think that's why education can really tackle this very specific type of violence that is young children and teenagers being products of their own environment. And when we have really strong discourse coming from pornography and factors like that about what sex looks like and what sex should be, we really need strong education coming in the other way about the reality of life in order to keep children safe. So that's why my focus is so on education. I also see it as preventative.
Chanel, I also imagine through education, you got kids who are learning about this in classrooms together. So they're having conversations with each other where, you know, kids in grade 5 and 6 aren't necessarily talking about this stuff in the playground, but if they're talking about it at school, I mean, what an amazing thing to be, the discussions to be having.
Of course, and the taboo that lifts on our society in terms of, you know, I'm sure a lot of students will go home and speak to their parents about what they learned that day and then have the opportunity to engage in further conversations to where the parents are comfortable with. And, you know, once we do lift that shame and taboo, especially for young children, kind of pre-teen, we're really creating a culture where we're keeping students safer.
Well, it's an extraordinary thing that you've done, Chanel. On behalf of parents in particular across the country, thank you so much.
Thank you so much, Lisa. It's so nice to see you. Nice to see you all.
Look, I think what's really powerful about that, just that little clip, is the power of education and the importance of listening to our young people. And as I said, Chanel's had an amazing impact on consent and sexuality education across the country. So what do young people want to know about, and what are they getting in their education? So this is some research I was involved with back in 2016. And I just really want, and I'll be moving from this to much more recent research, which is consistent. But these were the 10 issues that young people wanted more information about in their sexuality education in schools: violence in relationships, sex and gender diversity, love, how to stay safe online, how to end a relationship, how to start a relationship, more practical examples of sexual practices, more examples of sexual activities, masturbation, how to give and get pleasure, and pornography. And I know there's a lot of teachers here this afternoon, and I want you to reflect on how many of those that you actually cover in your current classrooms. In addition, we're very lucky that just in the last couple of weeks, the 7th National Survey of Australian Secondary Students and Sexual Health was released. And I'm going to focus on a lot of that data today as well. But I just put one graph up there about where young people are going to seek information interestingly enough, friends are right at the top, but look at the second one. It is school. It is, and when we drill down into that data, it is school-based education. You can see the additional areas there, and I'll come back to that later. But what's interesting is that young people really trust the doctor and the GP, but compared to schools, internet, mum, you know, that's not what they're using. In addition, the Australian curriculum and legal changes are another important context. And we know that the current version of the Australian curriculum includes specific content in the HPE area around the teaching of consent and respectful relationships. And in line with what Chanel was saying, you know, it's addressing the role of gender, power, coercion, disrespect, and abuse in violent relationships. So we now have it in the Australian curriculum and the Victorian curriculum as well. And I've just put this up so you to just get a sense of what that means in terms of the content descriptors when we go from F to year 9 and 10. And you'll notice that at F, from F to 3 and 4, they use the word permission rather than consent. In the national curriculum in Victoria, we use the word consent. So you can see that this education is beginning very early around personal spaces, about what it is, strategies to use to seek, to give and deny consent, you know, right through to years 9 and 10, when there's an examination of strategies around communication, seeking, giving consent, expressing opinions, needs, etc. So it really is that developmental and sequential approach to education. Now, in Victoria and in New South Wales, we have, the law has changed so that we now have affirmative consent. And basically that means that, that there is a responsibility of gaining consent before engaging in physical activity. So it is a clear, simple, enthusiastic go-ahead. So this could include, but not limited to, verbal asking and getting a yes, but it's also about physical gestures like a nod or reciprocating a move, like removing clothes. Now, I know some of my colleagues are a bit concerned about that, because if you take young people who may struggle with sort of verbal ways or interpreting physical gestures, we need to be very careful that it's very clear. And perhaps removing clothes may not necessarily mean that they want to have sex. But in addition, it is now a crime to sleeping, which is the removal or tampering of a condom during sex. And there are much stronger laws around image-based abuse, which includes videos of somebody without their consent distributing or threatening intimate images, in line with what we saw during that pornography ring. Now, I was going to show you the little lacy green YouTube, but I think I'll leave that. But look it up. It's Lacy Green on consent, and it's a wonderful short clip around what enthusiastic consent looks like, and a wonderful resource to use with our year 8 to 10 students. So the research. So, you know, this is, you know, so the context for the development of resources is our evidence base. Now, this is the most recent Australian evidence we have on young people's sexual well-being and young people's sexual behaviour. Now, of course, this is a survey that's been going since 1992. So we now have longitudinal data over a long period of time. And I'm going to share a little bit of that with you. But my suggestion to you, if you are in this field, download the report, even if you just read the executive summary. You know, it is really important data. My experience of developing curriculum, you know, over the last 35 years is this research is how I develop my teaching and learning approaches. You use the evidence. And I know as teachers, you do that all the time. So use the evidence that we have. And some of it is quite surprising in terms of its changed. So just that this is the gender identity of the young people in year 10 and year 12 who undertook the survey. You know, unfortunately, there's not an even distribution, but one of the really positive things is we have trans and non-binary young people in this particular data set. So in terms of sexual behaviour, and as I said, I am just touching the iceberg of this large report. So, so we have what young people's experience, so 58.5% engaging in oral sex, 52% vaginal sex, and anal sex, 15%. But if you then go to have a look at the sexual practices in the graph on the same slide, you'll see that 90% of young people are engaging in masturbation. So that's a really positive aspect about young people getting to know their own bodies in terms of the research we know about how important that is. And you can see the way 85.7% are viewing pornography. I'm going to talk more extensively about that a little bit later, but you can see that data right down to 15% of kids engaging in anal sex. So there's a broad range of practices that our young people in our schools are engaging in. So change over time, I think this is really interesting. And so for so many years, by the time, we would say by the time kids leave school in year 12, about 50% of them are engaging in sexual activity. It's now 68.9%. And so for year 10, it's 43, for year 12. So that's a significant increase in terms of the practices that young people are engaging in. And obviously the way that the survey is defining sexual practices is broad, and we need to be broad to understand the practices that young people are engaging in. Look at pornography and the ages at which young people are engaging in this. 13.6 years of age is when they first engaged in that practice. So you can look at the data there to see the ages that young people are mean age of first experience. So, you know, that you can, vaginal sex is 15.3 years, oral sex 15.2, anal sex 15.6. And so that data has sort of changed over time. And if you go back to change over time, look at 1992 when the survey first started to 2021. So interesting data there and important data for us as educators of young people. Experience at last sexual experience. So in 2021, 75% of young people knew that condoms were available, 49.3% used it. Now have a look at the data over time. Look at 2008 back to 1992, where the awareness was, you know, about 70%. But look how high the use was compared to the cohorts of 2013 and 2018. And obviously that's around issues to do with HIV and the focus on condoms. And I guess that's something for us to think about as educators of young people. You know, have we dropped the ball around some of those issues that we think young people are aware of? Now, I found this quite encouraging. Feelings at last sexual experience. So if we look at fantastic through to happy, look at the percentage. You know, that's really high. Overwhelmingly, our young people were either extremely, a lot, or a fair amount, fantastic, satisfied, excited, or happy. So whereas, you know, they're in terms of those sort of negative aspects of sorry, guilty, regret, I think they got that graph a bit wrong there. So they were much smaller percentages. Now that has changed over time, absolutely. And if you look at the wordle that they did, the word that jumps out at you as wanted, consensual, good. And if we go back to what the sample involved, there was more females. So I found that quite encouraging. And there's lots to unpack there. And in fact, I was using this to develop an activity today for catching on and put this up so that the kids can unpack that. What does that mean? A percentage of young people who discuss various topics with their most recent partner. So you can see having sex is very high. How to get sexual pleasure. I thought that was an interesting one as well. But quite low, though, is in avoiding STIs. And I think consistently with that data around condoms, maybe that's telling us perhaps that we're, you know, the work that we have done in the past in that area has been more comprehensive than we're doing now. Knowledge. Again, this is just a snippet of what's in there. So the graph on the right-hand side, they're the STIs that young people are aware of, so that overwhelming they're quite aware of STIs. We know that over 80% of young people know that HIV can be transmitted through sex, that condoms protect, and that healthy-looking people can transmit HIV. Now, sexting. So this is an area that gets a lot of public discussion and a lot of discussion by teachers through the recent consultations. So looking at, and I think it's an area that as adults we have our head in the sand a little bit, and I'd like us to work through this and to be thinking about how we provide relevant education for our young people. So we know that 82.7% have received sexual text. Nearly 80% have received photos. Over 65% have sent sexual text. Nearly 60% have sent sexual photos. Over 50% use social media for sexual reasons, and nearly 20% have sent photos of somebody else. Now, when we have a look at this, and I thought this was just really interesting data, and so this is the only one where I've pulled out a table because I think it's something is really important to point out. So this is by gender. So sexual images sent. Someone in a relationship with. So overwhelmingly, kids are sending images whilst in relationships. So 72.9%. So in the context of a relationship. So we've got to get this into our head that this is part of young people's relationships. So I think that is a really important thing for us, to remember. And then you can, the other one that I want to point out is that you can read that yourself. And as I said, I think you should, delve into this data yourself. But when we go to identifying information shared, so if you have a look at, sort of the differences around gender here between males and females, there's quite significant differences. Look at the type of photos. So suggestive, eye in underwear. So, you've got females, 85%, males, 66%, trans and non-binary, 84%, about 80% sending suggestives. So semi-nudes, you've got, for females, 83.5%, For trans and non-binary, about the same. For male, 62%. Now look at the nude. The nude, so this is where we've got females 43%, males 74%. So there's a real jump, and perhaps, you know, that's the dick pics. So, but I just think this is really important to start to sort of unpack some of this data. The reasons, so we can see pressure from partner, peer pressure, and to fit in, and to show off. So, and to get somebody to like me. So, they're areas, and to get attention. So there's some of those areas where kids are really sort of trying to get some affirmation and try and fit in. And then you've got these other reasons. 54% sexy, present for a partner, to feel sexy, to be fun and flirty, to get compliments. So because I received one. So this, is important, real data from young people about the reasons they are doing this. So I want you to keep in mind what you've just seen, and then have a look at this one. So this is attitudes to sexting. So 95.5% of kids know you have to be careful about sexting. They know that sending photos can have serious consequences. They know sending photos are risky. However, really high amounts, close to 2/3, sexting helped me learn about my partner's gender, sexual identity. It helped me be more open about sex and sexuality. Helped me learn about my sexual identity as a regular part of relationships. It's good to sex with partners, and there's no harm. So, again, we've got to rethink, well, particularly, older people like me, that this is young people's, the reality of their intimate relationships. And, we need to be able to validate, yet assist them in making sense of their intimate relationships. So coming back to the help seeking. So this is where young people sought help. So first one is friends, and that's changed over time. Friends used to be, if we looked at that historical data further down, they're much higher now. But school remains a really important place where young people seek information. And when you drill down it, actually in the school-based programs. So they're using the internet, mum again, social media platforms, sexual partners. And as I said before, they really trust GPs, but they're not using it. And if we go down to the bottom part of that graph, areas where you think kids may be accessing it, like the nurses, the youth workers, community services, community health services, they're not. So again, we need to be reorientating what we're doing in terms of understanding the help-seeking behaviour by our young people. And this is just a word cloud about the platforms. So for young people, the big one that jumps out is Instagram, TikTok, YouTube, then Google, going down into a range of others. And there's very few academic articles in there, I can tell you. So again, being aware, look, even porn is quite big in terms of that. So again, being aware of those social media platforms. Unwanted sex, and this is where we go from feeling really good about that last sexual experience to over 20% of young people felt frightened of their partner in the last 12 months. Nearly 40% of sexually active young people had experienced unwanted sex, and 23.3% of those had experienced unwanted sex talked to somebody about it. So that's actually quite low. And here we look at the historical data again. So percentage of unwanted sexual experiences in 2021 was 41%, and 5% at the last sexual experience. Now look at 2002. It's nearly half of of that. Now, that could very well be because young people have a better understanding of unwanted sex is. And so that's where that qualitative data comes in. And there's some wonderful qualitative data in this where young people are talking about their sexual experiences, but I don't have time to share that with you today. I have used some of it in the latest Catching On as for teaching activities, so that will be there. But just so as I was saying, you know, that some of this is in contradiction to some of the other data. Pornography. Now this is, you know, that an area that has caused parents and schools a great deal of challenge. And so ever viewed pornography, 85.7%. Now look at the frequency, 14% daily. So of our young people in year 10 and year 12, some 14.1% are viewing pornography daily. 20%, just about 20% weekly, nearly 15% monthly. So they are, you know, that very, and this is my argument, and this is not what I'm here to talk about today, but I say if we don't show kids what consensual, age-appropriate sexual activity is, when we can't not expect them to access pornography. You know, unless they see it in another context where it is consensual and it is age appropriate, then what are they going to do? As the data I showed you early on, they want to know about sexual activities. They want to know how to please partners. They want to know that information. But it's very challenging for us as teachers to cover it. So if we look at the total percentage of young people by gender, you can see there's very little difference. Or not only by gender, but also by sexual orientation. So it's all young people who want this information. They want to know what sex looks like. They want to know what it involves. So coming now to school sexuality education. So the question, they looked at, had they ever received RSE in schools? So, you know, positively 93.9% had. And I haven't looked at the data by school type, but I suspect, going back to what Chanel Contos talked about in her testimonials with young people, that began because of elite private schools in New South Wales where there was no education. But we have covered consent education in government schools for nearly 40 years. It hasn't been mandated, but anybody who's been teaching comprehensive sexuality education has been doing some work in this area. It may not be as good as young people would like, but there has been. Worryingly, though, young people who found RSE very or extremely relevant was only 24%, which is down from 2013 and 2018. So again, we're not keeping up with what young people want. So hopefully you can read this, but it's percentage of young people reporting that specific topics were well covered in their most recent class. So at the top, of course, is puberty, correct names, knowledge of female reproductive systems, respecting relationship, how to make somebody, how to make sure somebody wants to have sex, knowledge about male reproduction, making informed decisions, sex between man and a woman, laws about sexual contact, and then, you know, sexting, cyber safety, choosing to have sex abstinence, how to reduce STIs, use condoms, and a bit of love and intimacy. I suspect that that's what our school programs are. But have a look at the list at the bottom. That's what young people, the research is showing us they want. You know, that they want to know about having sex with somebody who's a disability, anal sex, digital sex, safe sex between two women, safe sex between two men, masturbation, oral sex, practical information about how to have sex, sexual orientation, different gender identities and expression, sexual pleasure and enjoyment, pornography, testing for STIs, long-acting contraception, short-acting contraceptions. So, you know, I raise that because we're out of step with where young people are. Okay, I better be careful. I'm not babbling. Yeah, I'm just about there on some time for. So this is what is currently happening in Victoria. All our resources are being updated. Building respectful relationships, that years 8 to 10, that's the respectful relationship. Resilience rights and respectful relationships, that's F to 12. And our catching on resources, which were the original catching on for secondary schools, 9 and 10, I wrote 20 years ago. So it was updated in 2014, 2013, catching on early was written. So these are all being updated, and this is the mandate. It's got to be holistic. It's got to align with Victorian curriculum, cross-referenced it to our respectful relationships. Resources must address new and emerging issues, such as the ones that the young people have identified, incorporate reproductive, menstrual health, stigma, pain, etc. Ensure content is inclusive of the particular groups of young people and students there. So that was the mandate requirements that we've had. So we've consulted with students, teachers, stakeholders, parents, and there is now a draft of all of those resources, which are going back for a second level of consultations. But I just thought I'd share some things that the students sent us during the consultations. So acronyms of teaching about consent are confusing. Just tell us as it is. Current approaches to safe sex and consent are condescending. Don't sugarcoat things. It leaves students vulnerable. Separating students into girls and boys is outdated. Importance of having in-depth discussions about our assumptions about gender of people and our own assumptions. Better if there's diversity, not just non-binary, but all diversity. Need to focus on online environment. Talk about consent. Let us have a rant. Let the, get rid of the curriculum. Let us talk. Include pronouns. More ways to deal with online harassment. Discussing boundaries, emphasising listening, changing to non-binary names, and some of the more specific feedback we got about not using assigned, say, female at birth, only for medical reasons and broader concepts. This is some of the things students wanted covered that came out of those. What happens to boys and girls, learning about STIs, how to have safe sex, sexual safety, why is consent important, consented law, giving clarity on masturbation, personal pleasure. It's okay to feel pleasure, covering non-heterosexual relationships. The same things that I've just talked about, you can sort of read that as well. Then finally, advice to teachers. We all love this as teachers, isn't it? Deal with the immature students. And I know there's probably teachers there laughing. Cover outward influences of stigma. It should be earlier. Don't beat around the bush. Get to the point. Don't. You can use metaphors, but say what it actually is. Same things that we got before. Please teach people that asexuality is okay and valid, underrated but important. Stop sugarcoating. Include pansexuality. More things that people don't feel attracted to in romantic ways. I want to finish up so you've got some time for, they want demonstrations. That's the point I wrote before. Consent, not judging people. Just teachers like not being awkward in general, because it's hard to learn when the teachers haven't really learned the topic themselves, or just kind of like not willing to like tell the class about certain topics, because teachers can definitely take the wrong way. So like if they're the engaged teachers, then also means engaged staff. The teachers being very clear about what's going on for the lesson, knowing in advance, etc. So, no, that was a very quick whip through. So thank you and questions. Look, I just want to say, you are, as teachers, you are extremely skilled, and a lot of the comments from kids come because there has not been professional development from teachers in sexuality education for over 20 years. So hopefully these new resources will mean that teachers will have access to professional development.
Thanks so much, Debbie. So we have a couple of questions, and I have a feeling a few more might filter in as we get started. Hopefully a quick one with questions. First of all, she asked, we heard about catching on early / later a little bit before. When are the updated resources? When are the updated versions of those expected?
Look, they're expected, I would say, realistically next year, because what they have to do, and look, and it's terrific, they're going back now, there's drafts of them, and they're going back again to teachers, to students, and to stakeholders, and to some of those cohort groups that were on that slide, to make sure the language is correct and to future-proof them in many ways. And they need to be cross-referenced, because one of the difficulties, if I had my way, and don't sort of quote me, there'd only be one resource and this would all be embedded, so it'd be easier for teachers. But just to let you know, Catching On now is one resource. It's not two, and it goes from F to year 10. So, and look, and I didn't have time. I was going to talk to you about the sexual ethics framework that is within that, because it is moving, including a rights-based approach, but it's moving to care for self, care for others. It's moving into that that care environment. So that's a whole nother talk, really.
My mistake. Another question from Tammy is, can you point to any data? What can you tell us about dating apps being used by young people? We heard a bit about social media, that they're going to social media for sexual health information. But what about dating apps?
Look,
for example, Omegle and Yellow.
Kath Albury is the expert in terms of this work, and she's done brilliant work. So Kath Albury is at Swinburne University, and she's done brilliant work in this space. So there is data there, which is very consistent with the sort of data that is coming out of this in terms of young people.
Great. There's been a few questions, so I'll just mention we have recorded this session, and it'll be on the CERSH YouTube channel, so you'll be able to check out the slides there if anybody's hoping to catch them. One question from Lucille. So consent is now mandatory, but how are we equipping young girls to be informed and empowered by their pleasure? Is consent not just one part of the bigger picture, the first step towards holistic sexuality education? Pleasures first to harm prevention in line with WHO recommendations?
Brilliant question. And the resources take a sex positive approach, and very much in line with, that's why Maura Carmody's work in sex and ethics is a brilliant framework, because to understand even sexual assault, you need to understand pleasure. So it takes, yes, so there's a very strong focus, and it was interesting. So orgasm, probably haven't seen a teaching and learning resource that coming from the department that's got the word orgasm is, but you will actually see that as well. So very, very important. And look, there's a wonderful video that comes out of Sweden, Sex on the Map, which shows sexual activity of young people in an animated way, and it's a brilliant resource. So there are sort of resources to help this work as well.
Fabulous. So we don't have any more questions. One person, Yolanda, has their hand up, but unfortunately we're unable to send through, unfortunately we're unable to give them the microphone. Bron's just asked if you could repeat the name of that video.
It's called Sex on the Map. It's a subtitled film, but I've used it with kids at year 10 and year 12. And it's so riveting that they get used to the subtitles pretty quick.
Great. So we'll just hold on to 1 second in case any more questions drop in the chat in the last minute that we have. Other than that, I might start wrapping up. Thank you so much for your time, Debbie. As I say, we've recorded this session and we'll make it available on the CERSH YouTube channel. If anybody, would you be able to make the slides available too for folks who email and request them, Debbie? Is that okay?
That's fine. Not a problem.
Okay, great. So if you send through an email to the CERSH admin, which you should get from your registration emails, we'll be able to sort that out for you.
And apologies about my background. The sun came out.
Okay, it looks warm and sunny there as opposed to cold and rainy in northeast Victoria. All right, so apologies for anybody who did have a question that we weren't able to get to. We're seeing a lot of thanks so much in the chat. So let's give Debbie one last digital round of applause and thanks for her time. And I hope everybody has a lovely evening.
Thanks very much.
Cool. Thanks so much, everybody. As I say, keep your eyes peeled with our newsletter for further professional development webinars. Hope to see you soon.